morning, everyone. My name is Sharon Boudreaux, and this is
Drusilla Baldwin.
and Miss Boudreaux. Why don't you go ahead and tell them how old you are?
You're not supposed to ask a lady an age.
Well, they want to know that.
Well, that's not nice. I am 67 years old.
Okay, so Miss Boudreaux is 67 years old, and she is a resident of St. Agnes Nursing Home, and she has agreed to allow me to do 3 mental status assessment tests. Is
Yes.
that correct? Okay, good. So what we're going to do is so today we're going to do 3 separate tests that actually will assess the mental status of an elderly client. The first one's going to be the mini-cog, and this is a screening used to detect any kind of cognitive impairment in an older adult. And included with the mini-cog is another test called the clock drawing test. And the thing about the clock drawing test is it tests the cognitive impairment, but it also, in addition, assesses numerous cognitive domains, which include the cognitive function of an elderly adult, memory, language comprehension, visual motor skills, and executive function. So this test adds another element to the mini-cog. And then the third test that we'll be doing is called the CAM, otherwise known as the Confusion Assessment Method. And this is a test that tests for the absence or the presence of delirium. And delirium is a sudden change in someone's thinking ability. So because delirium can sometimes be subtle or often it goes unrecognized, this is a test that can be done on an initial admission. Now the CAM test is done in a hospital setting. There's 3 different versions of it. We're going to do the 3D mini CAM test. So let's go ahead and first start with the mini COG test. Okay, so Ms. Boudreaux, please listen carefully, and I'm going to say 3 words that I want you to repeat back to me, and then I want you to try to remember them, because what I'm going to do is I'm going to have you do something else, which is draw the clock. And then after you draw the clock, I'm going to come back and ask you to repeat those 3 words. Okay? Yeah, don't worry. So go ahead and I'm going to say the words and then you're going to repeat them after me, okay? Daughter, heaven, mountain.
Daughter.
Take your time.
Daughter, heaven, mom.
Okay, and can you repeat them one more time after me? Daughter, heaven, mountain.
Daughter, heaven, mom.
Okay, so this next test should take approximately 3 minutes, and then when the 3 minutes is up, we'll come back to the 3 words that we just mentioned. Okay, so what I'm going to have you do, Ms. Boudreaux, this is a blank circle, but you're going to draw all the numbers of the clock and try to put them in the approximate place where they would be. Once you draw the numbers, then I'm going to want you to make a shorthand and a longhand and put the time of 10 minutes past 11, which is 11:10. Think you can do that?
Yeah.
Okay, go ahead. Take your time.
Said 11:10.
Correct. Okay, that's wonderful. So she's already, Ms. Boudreaux has already completed the mini clock, clock drawing test, and then now what I'm going to do is I'm going to have her complete the mini clock test. So can you repeat me those 3 words that we talked about at the beginning of the test?
Daughter.
That's okay. If you can't remember all 3 names, just say the next one.
Daughter and mom.
Okay, good. Okay, so that concludes the mini cog and the clock drawing test. And what I'll do is in my summary form, we're going to go over what points add up. So as far as word recall we go, she was able to get 2 points. So it would be 2 out of 3. So there is a form that you fill out, and then it's going to let us know where she rates. And for the clock drawing, the total number of points would be a 2. And then we add up the score of whatever she gets, and it's going to be 0 to 5 points. So anything that would be less than 3 would mean that she would need further testing. And remember what we said, that the mini cog and the clock drawing test, it's used to test mental cognition. So now let's move on to the confusion assessment method. And this goes when once we finish the test, because time-wise we have to get the video done in 10 minutes, I'll go ahead and I'll give you all your results. Okay? And then you can keep them and give them to your doctor. And I'll go over them with you. Alright, so this is the CAM test. So what I'm going to do is I'm going to ask you some questions and take your time and answer, okay? Now some of the questions I'm only going to be allowed to repeat once, but some I can repeat twice. Alright, so and these questions all have to do with your thinking and your memory. Please tell me the year we are in right now.
2016.
Okay. Please tell me the day of the week.
Saturday.
Please tell me what type of place this is.
The nursing home for the elderly.
Okay? So now I'm going to read you some numbers, and then I want you to repeat them in a backwards order from the way that I read them to you. So I'm going to give you an example. If I say 5-2, then you're going to say 2-5, correct? So the first one is, okay, you ready? The first one is 7-5-1.
157.
Okay, so the second one is 8-2-4-3.
3, 4, 2, 8.
Alright, so please tell me the days of the week backwards, starting with Saturday. So what you would do is you would say the day that comes before Saturday and on. So tell me the days.
Sunday, Saturday, Friday, Thursday, Wednesday, Tuesday, Monday.
Alright, now please tell me the months of the year backwards, starting with December.
December, November, October, December, November, October, September, September,
Okay.
August, July, June,
Keep on, you're doing good.
what would I be?
Go on, June. So the month before June.
March, February, January.
Alright, good. So during the past day, the past 24 hours, have you felt confused? During the past day, do you think that you were not really in the nursing home?
No.
During the past day, did you see things that were not really there?
No.
Okay, so the next part of the CAM test, these were the 10 questions that we included with the client. And then the next 10 would be things that I would observe through my whole interaction with Drew. So what we're going to do is we're going to go ahead and finish the last 10 questions of the confusion assessment method. So we already did the 10 questions where you actually have to involve the patient in asking them questions. And then the next 10 would be based on my observations. So like question number 11 would be, Was she sleepy during the interview? Because that would determine, that would give her, that would be a no or a yes, and that would give her a certain score. Then was the patient stuporous or comatose during the interview? And she was not. Did the patient show hypervigilance, which would mean was she excessively responding to my questions, hyperactive, and she was not. Was the patient's flow of ideas unclear or illogically? And no, they were not. Was the patient's conversation rambling, inappropriate, verbose, or just not making any sense? That she was not. Was the patient's speech usually limited or sparse? No, that was it. She was not. Did the patient have trouble keeping track of what was being said during the interview? She did not. Did the patient appear inappropriately distracted by the environmental stimuli? No, there was no distraction noted. Did the patient's level of consciousness fluctuate during the interview? It did not. She remained alert and oriented. Did the patient's level of attention fluctuate during the interview? No, she remained very attentive. Did the patient's speech thinking fluctuate during the interview? She remained constant. So after these 10 questions are answered by me, and that gives her a score, then there's an optional 2 questions. But the optional 2 questions are completed only if the first part of it was not checked, and if the second part, if I notice any abnormalities in the first part or the second part, would I progress to the 2. So the last 2 would be that I would have to actually consult with the family members or the doctor to see if they've noted any change in it. And then the second part of that part would be, I would look to see if she has ever had any kind of mental assessment done, especially if she had a confusion assessment method test done, which I could compare the results. So that would conclude the confusion assessment method. Ms. Bozeman was able to score a 4 out of 5 in the mini-cog test included with the clock drawing test. So she was able to achieve 2 points in the 0 to 3 points for word recall. Remember, she was able to remember the words of daughter and mountain. Heaven was the one she could not remember. And then in the clock drawing test, she received all 2 points because she was able to put all the numbers where they belong, and she was able to label the time of 11:10. So that gave her the total score of 4. And so as I mentioned before, anything less than a 3 would be cause of concern or to be referred. Some guidelines that I did want to mention when doing any of these 3 tests is that make sure that the person has their glasses, if they have glasses, or if they have hearing aids, they need to have their hearing aids on. Because you don't want them not getting questions right because they can't see or hear what you're saying. You want to make sure that you want to make sure to code what you hear and see, because you don't want to put the answers based on assumptions that you make. And then make sure that you speak slowly and clearly, and that each question be stated twice when it can. Of course, on the confusion assessment method, there was 2 or 3 questions that you were only allowed to state once. And then remember that if the client is to say, I don't know, or not have any response at all, or the response doesn't make sense, then that's considered incorrect. And you don't keep pressing them on it. You give them the chance to say it, and then if they can't, then you move on. So those are just some general guidelines for the 3 assessment tests of the mental status. So we'd like to thank Ms. Bozeman for participating with us because she did a great job. And like I said, we'll do all the scores, and then I'll give you the results, Ms. Bozeman. Nice to meet you.